So my name is Yumna. I'm one of the junior doctors in the UK, and we've done a presentation comparing two prognostic scores, MIRACLE2 and NULL-PLEASE, in predicting survival and neurological outcomes after out-of-hospital cardiac arrests. So some background on the project. Out-of-hospital cardiac arrests remain a major cause of sudden death worldwide, with nearly 250,000 to 300,000 deaths worldwide. Early prognostication remains quite challenging, and prognostic scores can help guide clinical decisions, help us allocate finances in the hospital, and help with family discussions as well. So MIRACLE2 and NULL-PLEASE are two commonly used scores used for prognostication. However, there's very little direct comparative data, especially in small UK centres. So MIRACLE2 is developed by King's College London. It allows for early classification of patients admitted to hospital with successful return of circulation. It includes 7 variables which are readily available and can be used to predict poor neurological outcome at 6 months' time. So the higher the score, the higher risk of poor neurological outcome at 6 months. And then the other score is NULL-PLEASE, which includes a wide range of parameters which look at both pre and post-arrest parameters, including renal failure and extracardiac causes in predicting hospital mortality. So the aim of our study was to compare the performance of MIRACLE2 and NULL-PLEASE in predicting 1, survival to hospital discharge, and number 2, looking at favorable neurological outcome. We've defined favorable neurological outcome using the cerebral performance category score of a score less than 2. So that means the patient gained full recovery, could work, was independent of activities of daily living, or had some moderate disability but was able to work with some adjustments. So our methods, we did a retrospective single center study at a small general hospital. So far, we have available data for 39 patients who achieved ROSC after out-of-hospital cardiac arrests. We gained the data through electronic health records and then calculated both the MIRACLE2 and NULL-PLEASE scores. We then assessed performance using receiver operating characteristic analysis and area under the curve. So in terms of patient outcomes, out of the 39 patients that we had data for, 26 had survival to discharge and 24 had favorable neurological outcomes. So in terms of looking at the results, we'll break them down into survival to discharge and favorable neurological outcome. So if we look at survival prediction, MIRACLE2 had an area under the curve of 0.56, showing poor predictive ability in terms of predicting survival to hospital discharge, whereas NULL-PLEASE in comparison had an area under the curve of 0.74, which showed good discrimination in predicting survival outcome. And then if we look at neurological outcome, MIRACLE2 again had poor predictive ability, whereas NULL-PLEASE had an area under the curve of 0.73, which showed good predictive ability in terms of neurological outcome. So the key findings from our study is that higher NULL-PLEASE scores correlated with mortality and poor neurological outcome, whereas MIRACLE2 did not meaningfully discriminate outcomes for both survival and for neurological outcome. So in conclusion, in our single center study, NULL-PLEASE outperformed MIRACLE2. NULL-PLEASE may provide superior early prognostic accuracy and help with family discussions early on. However, we do realize that our sample size of patients is currently limited, and this would need to be repeated with a larger number of patients and in different centres in the UK to provide proper validation. That's the end of the presentation. Thank you for listening.